all, I thank you all for coming on a Sunday afternoon when I know during residency it's a rest day and you have spared your time for this session. So I would first like to congratulate you. You have all attained a very good rank, and then you have some of you have started your residency program, and then some of you are awaiting counseling. So the idea of doing this webinar was to orient the students who are preparing for NEET SS or INI-SS. And I would like to, dig into the minds of the toppers. How did you manage to crack the examination? Because I'm an old man now. So if I told the way I did it, I think it would be unfair because when we used to prepare, there were only 7, 8 seats, and it was a cutthroat competition. There were no resources available, no online resources available. So we have to depend on the seniors, their notes, and then it was a tough job to do that. And then typically we would take around 2, 3 attempts to crack it into the final ranks. But now things are much simpler. You have online resources available, and then with the AI coming in and everything, so things have become more streamlined. But yes, on the other hand, the competition has become much more tougher, right? So more and more people are preparing for the your super specialty examination, and then seats have increased, but I think that the competition currently is more than competition we had in our time. So what I will do is I will have a first brief introduction with all our speakers. So I would like that you can turn your video off, we can have a face-to-face discussion. So yeah, I so glad to see you all. Right. And it's a proud feeling that, if everyone is here, most of us. Good. Very nice. Thank you all for coming. So you can start one by one, maybe, I have the participant list with me. So we can start with Ayush, I think. Okay. So you can give a brief introduction yourself. What are you doing? What was your rank? And then one by one we'll go, right?
Hello, sir. Good
Yes.
afternoon.
Yes.
A warm good afternoon to all the participants and all the aspirants. So I hope I'm audible.
Yeah, you are audible. Yes, yes.
So I am Dr. Ayush Badani. I did my MS from AIMS Patna and I completed in September 2025. And after that, I prepared for the SGE and I've got AML rank 10. And I'm currently 1 month into my super specialty senior residency at AIMS Patna. It has been a wonderful journey, and I've been very grateful, especially to you, sir.
Right. Good. So then we have Dr. Jaffrey. Hi.
Hello, sir. How are you?
Hi, I'm good. All good.
Thank you for
So
having us here, sir.
before you start, I'll just introduce Dr. Jaffrey. So he is a special person. So he's basically from Army. So I think you are a captain.
No, sir. I'm a lieutenant colonel now.
Lieutenant Colonel. Sorry, I'm sorry for that. So he was posted in Congo, right?
Yes, sir.
Yes, so he wanted to become, wanted to have a specialty degree, and then he got interested in GI surgery. Once he got a rank, he made a point to come to my place before joining AIMS New Delhi. So it was so heartening to, coming all over everything. So yes, you can introduce yourself, Dr. Jaffrey. Yes.
Thank you, sir. I finished my MS from AFMC, sir, in the year
Right.
2021. And since then, because we have a contract that we have to serve a mandatory period before we apply for a super specialty. And now, because of so many reasons, and one of this is you, that I've been able to crack this INI-SS exam. And I'm into my first month of MCH GI surgery, sir.
Yeah, at All Indian Institute of Medical Sciences, your dream college,
Yes,
right?
that is my
Good.
dream. That is everyone's dream, sir.
We have Dr. Ozair. Dr. Ozair, yes.
Good
Yeah.
afternoon, sir.
Good afternoon.
Myself, Mohammad Azhar Khan, and I did my residency in general surgery from AIMS Rishikesh, and I completed in August of 2025. Then I started preparing, and I cleared this exam with an AML of 15, sir.
Right. Congratulations. Lovely. So we're waiting for the counseling, right?
Yes, sir, waiting for the
You're
counseling.
waiting for the counseling. Good. Then we have Nilay, Dr. Nilay Kelkar.
Hello, sir.
Hi.
Yeah.
Hi, Nilay.
Good afternoon, sir.
Good afternoon.
Yes, sir. So I completed my MS surgery from BJ Medical Pune and in February 2025, and then started to prepare for the INI-SS exam. This was my second attempt for INI. Before that, in the April session, I had done, and then right now in November session, and I scored for an AML 6 and CML 8.
Perfect. Right. So you are now in AIIMS Bhubaneswar, right?
Yeah, currently I'm in my first month of my residency into AIIMS Bhubaneswar.
Okay, good. So next we move on to Dr. Ankit, D. Ankit.
Hello, sir. Hello, everyone. And
Hi.
sir, first of all, a big fan of yours teaching, sir. Sir, I never knew like that surgery can be so interesting by listening to your videos. Like 2 hour when it goes, I can't know कि 2 घंटा देख लिया मैंने. So coming to the fact, like I'm from AIIMS Bhubaneswar, sir. I have completed my
Okay.
residency MS in AIIMS Bhubaneswar. Last year, August 2025, I passed, and I attempted INI this first session. And big thanks to you for your teaching. I cleared it in first attempt only. And I'm
Perfect.
currently
Good.
joined in AIIMS Bhubaneswar with Nilay, and in first
Nilay.
month we have completed.
Good, good, good. Lovely. Then we have Dr. Chakravarti.
Good afternoon, sir. Good afternoon,
Yeah.
everyone.
Yeah.
I am Chakravarti. I am from Kanchipuram, Tamil Nadu, and I did my MS from JIPMER, Pondicherry, sir. I finished in 2023 December. Then I worked there as a SR for 1.5 years, sir. Then I took off and prepared for INI and NEET, sir. I got AML 3, CML 15, sir, and
Perfect.
NEET rank 36, sir.
So
I am yet to join. I am waiting for counseling, NEET counseling.
counseling. Yes, yes, yes. Okay, good. Then I think we have a veteran also with us, Mohammad Hamza. So he basically qualified last year only, last batch. And I think that we can include him also. So Dr. Hamza.
Good afternoon, sir.
Hi.
Hi, colleagues, dear colleagues. I have a very experience of AIIMS because I have given AIIMS 4 to 5 times, and I got rank 10, rank 11, rank 16. I got a lot of rank in AIIMS, but I was determined to join at AIIMS Patna because I have done UG, PG from AIIMS Patna, and I got good rank in NEET also. I was getting SGPGI Lucknow, but I have not taught by Basant sir. So it was a very wonderful experience, and now I am doing my 7 month of residency from AIIMS Patna.
Good, good, good. If I have left anybody, you can just drop a message here. So maybe we'll start. How do you go about preparing for the examination? So the books I think are common, right? So I would like your take upon the books. So which is anyone can chip in anytime. So So primarily you have only 3 books to cover. So you have Shackelford, you have Sabiston, and then you have Bloomgard. So what is your primary book to refer? So anyone can come in at this point of time. So what is your primary book to go to? Is it Sabiston, is it Shackelford, or is it Bloomgard?
So I'll give the perspective in terms of someone who is doing their residency and who has limited time to prepare. For me, my primary source of reference was Sabiston. Only after your classes, when I made the notes from your classes, I started referring to those topics from specific topics from Bloomgard and Shackelford. Also, what I realized is you had taken a session just before the exam in which you had specifically talked about the newer topics in Shackelford. And I was amazed to see all those similar topics, including your saying that immunotherapy would be a big thing in this coming exam. And there were so many questions on it, including the latest trials, which made me realize that one needs to go through the latest updates, especially from the new Shackelford. But sir, still, if you are in your residency, sir, I feel Sabiston is your go-to book because that gives a good layout as well as a good storyline. Then some
Right.
chapters from Bailey, like liver transplantation, better written is what I felt. But then definitely, sir, to get an extra edge, someone does your classes and goes through the notes exceptionally well, or refers to those topics from Bloomgard and Shackelford if they have less time, sir.
So what I feel that you should have a go-to book, and as far as the NEET SS is concerned, I think your Sabiston and Bailey are more than sufficient. There's no need to go beyond Sabiston and Bailey, because in NEET SS you have to cover all the specialities. It's not that you have to read only GI surgeries. You have to broadly cover all the specialities. So I think Bailey and Sabiston is just more than sufficient. If you read that book maybe 3 or 4 times, you're almost through NEET SS. I don't think there is any confusion in the books for NEET SS. But what I've seen in the last few years, even in this NEET SS, I'm not talking about INI-SS, the question standard are becoming a more, kind of practical way. So they are kind of looking for guys who have worked in the wards, who have seen patients. That is my feeling. I don't know what you feel, because the questions that I saw were more about practical management. A patient comes to you, he has a presentation. So more the examination pattern is moving towards conceptual based. It's not about mugging things up and remembering the facts and all. Yes, these questions are there, but they will unlikely give you a rank if you want to be in the top, maybe in 100 in NEET SS or in top 10 in ESS. So you should have a very clear framework, and actually they are looking for people who are actually working. Right. So I would recommend that if you're working somewhere, you should not leave your work. So at the same time, so there's a common misconception that you have to leave your work and then sit for 6 months and then read your books. Gone are the days, I think. So I think currently you can still get a rank, maybe in top 10, maybe you can be a topper also, if you're working and then you study. That makes perfect sense to me. And I'll give you my example only, because when I gave at that time did not have any SS, so we had separate examinations for AIMS and SGPGI. So I was a senior resident. So finally, maybe third year, yes, I was a third year senior residency in PGI Chandigarh. And PGI Chandigarh is known for a very rigorous work. We don't have any time to study. Forget about reading Bloomgart and everything. Yes, I read Bloomgart, I read Shackelford, everything. But obviously, I did not get time. So maybe 2 hours a day was a blessing to me if I get to read and all. But the only thing was that I was busy in my wards. I was seeing patients, and I basically PGI, the general surgery caters to everything. So we do everything, transplantation. So our unit used to do transplantation, vascular surgery, everything was there. So I had a fair bit of idea about all the GI surgery cases. So the questions that were asked, like I thought, oh, I've seen this patient, I've seen this complication, I know how to manage that. So in spite of the fact that I was not very, I did not remember many things from the books, but I knew what to do, what not to do. So it was just like, I just gave it casually. It was a very casual examination. So that is how things are even today, and people are moving towards practical aspect of the books, not just most common, least common, gold standard, silver standard, bronze standard. Gone are the days. I don't think they will go to that thing. So that is one thing, that if you're working somewhere, keep working. There's no need to leave your job just to sit and prepare. I don't think it doesn't make any sense. So this is one part, because many people used to ask that should we leave and sit for 3 months or 4 months. I don't think. You can continue work at the same time you can study also, because studying continuously becomes very monotonous, and then nothing goes in your head. It's just you are reading a book. If you're working, then it's just like a work-life balance also. So that is one point. So coming to your examination per se, for INI-SS, I think you should pick one book. Sebastian is there definitely. That is your baseline book, as Ayush mentioned in your residency. But for INI-SS, you should have mastery over, I think, Shackelford. And I think Bloomgart, there's no need to read the entire Bloomgart. It's basically HPB only. So you have to be very mindful of the fact that you have to utilize your time correctly, right? So HPB is around 30 questions, maybe 35 at the max. So reading 2 volumes of Bloomgart for 30 questions, if you read that, if you utilize that same time in reading Shackelford and Sebastian, maybe one more time, you'll have more purchase of your time. So that's what I feel. So for Bloomgart, maybe important topics you can cover, but one book I think you should cover is Shackelford and Sebastian. That is non-negotiable, I feel. I want your opinions on that. I'll start with Dr. Zafri.
So I agree with you when you say Sebastian is a go-to book in our residency. It was for me as well. I also used to refer to Bailey.
Yeah, Bailey is perfect. Yes.
Yes. But I believe when I was preparing for my INI-SS this time, there are certain advances that they have made in the 28th edition of Bailey also. So there are certain references and texts and the tables that they have gotten from Shackelford as well as from Bloomgard.
Right.
So I really liked it. Even if you'd notice, the esophagus in Bailey is very nicely done, and they have brought in all these tables from Shackelford directly. So that, because sir, we will have very limited time, I believe, when we are going through this intense preparation for INI-SS, and I think Sabiston, Goto, and Shackelford for certain topics. And you keep mentioning in your videos, I remember you kept telling that this is nicely written and you should go through, go to Shackelford and read this chapter from there. So those are the kind of chapters that I've read from Shackelford. Apart from that, I did not go through the whole book. And the ones you mentioned in the important topics in Bloomgard, you keep telling in your videos about those topics. I think doing those topics alone with your videos and Sabiston, I think can make a great foundation for INI-SS preparation.
Right. So I'll like to have comment from other people also. Dr. Oze, what do you think about the books to fall upon?
Sabiston is something that we all read during our residency time. So that is like much the basis of what we shall have, and like important topics, important tables, important charts, figures from Shackelford. Within addition to the specific topics like liver and transplantation and liver resection from Bloomgard.
So what I feel that
in addition, sir,
yeah, please.
Yes, sir. Yes, sir. Yes, sir. Please continue, sir.
So what I feel that our seniors used to tell us that Sabiston is nothing but a note of Shackelford. This is how they have written it. So it's a concise version of Shackelford. And, sometimes you have to read between the lines to understand Sabiston. And for that matter, Bailey and Love also. So because Bailey is a book that everyone's right from your MBBS days, you start reading Bailey's from your surgery posting. Even MS also you read, and even in MCH also you refer to that book. So that book is a Pandora's box, I feel. Every time you open Bailey, you find something new. So as your brain matures and as you start to understand the subject in a better way, you find new things. The same with Sabiston also. It's not that easy. You feel that it's so easy, as it has been written in such a lucid manner that you feel that, okay, oh, so nice. But actually, we have to read between the lines to answer the questions that will be asked. So I think it should be a combination for INI-SS. I'm talking about INI-SS for now. It should be a combination of Sabiston, obviously, because Sabiston is like any question, any line can be asked as an MCQ. So you cannot afford to skip any line from Sabiston. Shackelford is like you can understand the concept behind any topic. So if you're reading, say, biliary injury, so what is the foundation of biliary injury? How do you treat biliary injury? But Sabiston will not tell you that. It will tell you, okay, this patient has this, you do that. But why do that? Your book Shackelford will tell you, right? I think it should be a combination of both. So you should have to read Shackelford to understand the subject, and Sabiston to answer the MCQs. So I think it should be a combination of both Shackelford and Sabiston. But yes, you have to be very careful about your time management. So it's a big book to cover. Shackelford is not a very simple book to cover. It's a big book to cover. So the first reading, I think, should be of topics that are high yield topics. And as you prepare, what are the questions, what are the areas where the examiners tend to ask more questions. So even if I tell you, you can very easily say 25 topics, where every year you'll get questions from that. So CAGB is one topic, say, just for example, like carcinoma gallbladder. Every year you get a question from CAGB. So in the first reading, I think that you should cover the important topics first. So you cannot go skin to skin, cover to cover. If you have time, yes, well and good. But if you are, say, 3 months or 4 months from your final examination, it makes perfect sense to cover first the important topics. So that is, by the last year papers and all those things, you can make a list of topics where questions are frequently asked from. And INI-SS has a set pattern. The people who have qualified INI-SS, they can say that they have a pattern is kind of quite predictable. So you can actually predict which topics they ask questions from. So I think this is one thing that I would recommend students who are preparing. And I like your opinion on that. Maybe Nilay can chip in with his opinion. What do you feel?
Yes, sir, definitely. As you rightly said, Sabiston, we cover page to page in our 3 years of MS residency. But when it comes to INI-SS, we are just left with, I say, 2 to 3 months of preparation for most of the people. And
Right.
to prepare and to start with Shackleford becomes very heavy at the immediate the day of first day of preparation. So I somewhere felt for me watching your videos and then referring back to whatever the tables you had mentioned in your videos or the topics which you told like the esophagus or biliary injuries and then just referring to that okay, now this things whatever were you mentioned, like these things how are they given in Shackleford. So that helped me to understand how to read the important topics of Shackleford. Because when I just initially just if we start from just reading page one, it becomes so difficult and it becomes so vast. It just gets pressuring. So I think somewhere a guidance kind of which I think your videos definitely offered, that definitely helps us to understand what the book is all about.
So I just like to add one more thing in your preparation. So everyone has his own way of preparing for your examination or reading. So what personally I follow even now also. Suppose I want to read a topic, I have this tendency to refer to multiple sources, and basically somehow my brain is more trained to refer to multiple sources. Suppose I have to read biliary injury, so I'll make a point that I read it from every book. So one day I'll just dedicate to biliary injury only. Or if I'm reading, say, C-head of pancreas, so morning I'll start with Shackleford, I read C-head of pancreas from Shackleford. Evening I read from Sebastian, and then from the Bailey also, and maybe from Bloomgart also. So one day I'll just read about CHOP, and then I'll be like covering everything of it. So that is how I used to prepare. And then at our time, I used to make notes and everything. But this is how I feel that if your brain is given information from multiple sources, it tends to analyze information in a much better way. And so that even if the examiner has asked a tricky question, you know what he's actually asking from, because the basic concept does not changes. The books can change, but the theory part cannot change. So this is what I follow that, if I am reading a topic, maybe say I devote one day for pancreas, maybe I'm reading acute pancreatitis or chronic pancreatitis. I will read chronic pancreatitis from Shackleford, from Bloomgart, from Bailey. I know it's not recommended, but this is where how I remember things, because it's also I have to remember the facts also. So if you read from multiple sources, your brain tends to interpret it, because reading one book again it becomes monotonous, and then nothing goes in the brain. A topic is not given so well and you're not able to comprehend that. Better thing is that you read the same topic from different book. Maybe you can comprehend it better, and then you remember the facts also better. Right. So that is one way of dealing with a difficult topic. Not if a simple topic is okay, fine. But you think that this is a bit tricky topic and not able to get into the basics of it, and I don't know what to do, just read the same topic from a different book. You'll get a better perspective, because the authors are different. So all the authors that you see in Bailey, or they are basically top shots. So they are the best in their field. So if you read David Whitcomb has written Chronic Pancreatitis, is a big shot. So all Michael Gagner had a topic for, I think, laparoscopic pancreatonectomy in the last Shackleford. So they are big names. Once you go into the field, you realize that they're big names. So if you read if you're reading a chapter, basically you are reading the perspective of the author, right? So if you change the author, you have a different perspective. So that is one way of getting into the crux of all the matter. So maybe we'll take opinion from Dr. Chakravarti. What do you feel about how do you read a difficult topic? How to master a difficult topic?
Mostly I had a very less time only, sir. 3 months only I had for preparation. I used to watch the videos, sir, take notes, and whichever I feel like I wanted extra, then I will go to Shackleford for luminal and Bloomgart for HBB, sir. Only important topics I used to read there. And I covered all the tables from Shackleford, sir. No,
Tables
no
are very
images I have
important.
left.
Yes.
All tables, all images from Shackleford, Bloomgart, and Sabiston. All three books I covered, sir. And
So do you
for
take time
reference,
to cover all three books in 3 months?
tables, images
Tables,
only, sir.
yes. Tables, yes.
And only important topics, and whichever I feel my notes are inadequate, those topics I covered from Shackleford and Bloomgart.
So point about notes, good you raked it up. So what do you advise that should you make notes from different books, or because in the end you have very less time for revision. So how do you revise? This is a very very important thing. Some people make notes, some people don't make notes, some people read from books only. So there are various ways of preparing. How do you go about? Because you have got the rank, so we will you know listen to you first.
Sir, I used to divide my time 60/40, sir.
Okay.
60% of my time for preparation. Like if I add 100 days, 60 days for preparation, then 40 days for revision, sir. Then revision, I used to have 2 or 3 times revision. My aim is to narrow down the source, sir. First, I will cover 60 days, then I will reduce my notes, everything. I will highlight and I will try to cover it within next 20 days, sir. And again, within next 10 days, I have to cover every fully. I will highlight those things, whichever I need to repeat again. So, two, three revisions is a must, I feel, sir.
Dr. Ankit, what do you feel about notes and revision? It's a very important topic. People ask that should we make notes, should we not make notes? How do we revise? This is a very important thing to address. Such a huge
Sir,
subject.
making notes is also a skill, I will say. So
Yeah.
my strategy was I make notes very liberally. Like I leave lot of space while making the first note because I
Mm.
know things will get added later. And
Mm.
one of the trick that I used, which I learned in my NEET PG preparation, was to make the 20th notebook. So what I did, I kept a separate copy. Whenever I was doing an MCQ or going giving a grand test, I was keeping a separate note, whatever question I was making wrong, so that I don't have to run through my whole, suppose upper bowel, upper JK notes. If I have to focus on 5 question, I have my separate notes. Okay, ये 5 question को मुझे बाद में देखना है. So
Mm.
while making the first note, I leave lot of blank spaces. So while solving MCQ, I keep on adding the whatever point I'm missing. Or suppose if I'm watching a new video of yours or like any other sources, so whatever new concept is there, I kept adding on them. So in the end, I have a single copy in which I have all the things. I don't have to refer to multiple copies or multiple notes. My last 1 month was just my notes and my extra copy where all of my mistakes were noted down. Hardly it
Okay.
was like 40, 60 pages. I had all my mistakes noted down. And to be honest, out of those 40, 60 pages, I got 20 questions in INI final exam. So this
I
is the
think
very important thing. You should know what mistakes we are doing repeatedly. And we should not
right.
repeat that in the final exam.
Right. I think revision is a very important thing that most of us don't pay much importance to, because no matter what you read for maybe 1 year or two, if you don't revise in the last 15, 20 days, then it's very unlikely that you'll be able to reproduce that information in the examination. Right. So it's very, very important that you have to revise. There's no other option, because your mind is not trained to remember so much information, and then you can have to, information to answer the questions also. I think revision is a must. There's no compromise on that. So you have to revise whatever you have read at least 5 times. It has to be at the spinal level. In the examination, you cannot scratch your head and then start, let should I, what is the answer of this? It should be at spinal level, because their time is critical. You have to answer all the questions. So you cannot sit and, interpret in the examination. What is this like? It has to be just like the question comes and okay, this is the concept, this is the information, and this is the answer. That's it. Right. So you cannot, you have to have a very good time management there. And for that, revision is a must. And how do you revise depends upon what is your go to. Some people prepare notes, some people just revise from the books, some have bookmarks and all everything. So we used to have some colorful bookmarks, and then used to mark the important things. So everyone has his own way of revising things. And then I'll see some of my seniors, the whole room was with chart papers, with sticky notes and all those things. you know so that is how. And some of my batchmates just used to take screenshots from the tables and all that. They used to take screenshots, and they would make a folder of screenshots. So whenever they were in the wards and all, they would just reading the folders. So folder of of the tables, of the books in the important tables in Bloomgard, Shackleford. So they would take screenshot, make a folder of all the tables in maybe in their iPad. And maybe if you are say roaming around having tea or coffee, then you can just scroll through the tables. through iPad or something, even a mobile phone. That is a very good way of revising things. So a table, basically, if you have read the theory part, then interpreting and remembering a table becomes very, very easy. So table is a must. There's no compromise on tables and charts and intraoperative pictures from your standard textbooks. And it's a very good way of doing that. You just take screenshots from the books, make a folder of it. Sometimes, it's basically a pictorial memory, and it can flash at the time of your examination. Oh, I remember that table. This question is from that table. So that is very important thing. I feel that tables and charts, either you can take a printout and stick in your room, or you can take screenshots, make a folder. If you're not in the mood to read, just scroll through the tables. It's a very important, very easy way to revise things. So maybe, yes, Dr. Jaffrey, how do you revise such a huge subject? What are your strategies?
So I believe that if we have enough time, so if we start a little early, I would say about 6 months before the examination, then it is a wise decision to start making notes. And that's what I did. I started quite early for my INI preparation. And I was referring to your videos, making notes. First, so I would first listen to your videos, then go read Sabiston of the same topic, then go read Bailey, the same topic. So for me, the understanding of Sabiston and Bailey after listening to you would be much more. The things that I would not have understood before, I would understand now after having a great, perspective about the subject from your videos. And that helped me making notes, sir. So I'll make notes of that subject and we'll keep it aside and then move to a different topic altogether. So I realized that I could do it, but it took me some time to doing that. It took me about 2 months to 3 months preparing only the notes. So I did notes for liver, for esophagus, for stomach, but I could not make it for the luminals. That is one reason, because you also mentioned that the questions that come from the luminal colorectal part and the small intestinal parts is a little less. So I did not focus much. And the only thing I could not do is biliary part. I could not make notes also. The same towards the end of my preparation, right before the exams, it troubled me a lot when I did not have anything to go to and revise. So I could revise liver very well. I could revise esophagus, stomach, and those topics that I have made notes of really, really quick. But when it came to revising biliary and the luminal part, it took me a lot of time, and I was really struggling because I don't know which is the reference. Where should I go and read from?
Right.
I believe if someone has time, then it is a great idea to start making notes early in your preparation. And then things becomes really easy before your exam. 1 month before your exam, you have enough time to do it multiple times.
Then we come to the time management. So how do you manage your time between your work, and how much hours should you ideally devote per day to have a serious shot at the examination? So if you are really serious in cracking the examination, what is your recommendation? How many hours should one study after the work, maybe? Or if you're not doing anything, then you can study for maybe 12, 16 hours. But if you are, say, working and then you are studying also, what is the ideal time frame you're looking at?
During my end of the residency, when I was a little sure that I want to do surgical gastro, I had around 1 month of working and studying, and then 1 month of preparation before my final years. So I used that time judiciously to at least go through Sabiston and Bailey of GI surgery. And I referred to your videos once I was fully free. So I had basically divided my preparation into first month of entirely going through your videos and making short notes and taking clippings of whatever was important. Then I had devoted the next 1 month into 2 sections. The first 15 days, what I did is I made 4 separate copies in which I used to summarize one topic in 2 pages. For example, the cystic lesions of the pancreas, I would make a huge big table in the paper and I would note down all the important points which are there after the understanding, which I keep on forgetting. And in the next 15 days, while going through the questions, I used to keep highlighting and giving stars to those important questions which are repeatedly being asked. So what basically happened is my mind was sure that I'm basically reducing the amount of content which I need to read just before 7 days of my exam. So that also helped me in revision and time management, because eventually just before the exam, around 1.5 months, I was giving around 12 hours a day, 10 to 12 hours a day on an average. But while working, it would at least be some 3 to 4 hours of core study. I think so. This is minimum required to get a decent rank in INI because there's huge competition.
Yeah. So what do you feel, Dr. Ankit? What should be your time management? How do you manage your time?
Really speaking, like my I was not preparing anything during my residency as it was very hectic. So I can only give the perspective of if you are not working and you're studying. So if you're not working and studying, minimum I feel like 8 hours is minimum. At max you can go 10 to 12 hours. But 8 hours of good study within good fresh mind is more than enough. But if we are working, what I've experienced in my residency, after if you come from work, you can devote more than 2 to 3 hours. It's like hardly you can focus because you are doing patient management and your brain is tired. After that 2 to 3 hours of good studies, like you can focus upon. But more than 2 to 3 hours, I don't think anyone can focus nicely unless otherwise like your work is not that much hectic. It depends on if you're working and it's hectic, it's difficult to focus for more than 2 to 3 hours. But if you are in a center where your workload is less, then you can stretch it up to 6 hours. And if you're not working, then minimum of 8 to 10 hours is more than enough, I guess.
Right. So what I feel that more important than the numbers of hours you put in, what is more important is that you should have discipline in your, work management. So it should be like every day you should read for at least 2 hours, at least. So you can go stretch it up to 6 hours, or maybe on Saturdays, Sundays you can go up 10 hours also. But it's not that 5 days a week you're doing nothing, and then the last say weekend you start reading. So that is more important, that you should have a disciplined way of preparing for examination. So even if it is a very heavy day, 1 hour at least. 1 hour you just open your books, maybe refer to the notes, whatever you have prepared. So your mind should be tuned to this habit of reading every day, and that should continue for 6 months. There should be no compromise on that. So that is more important. Numbers of hours is basically relative. Some people are able to assimilate everything in 3 hours also, and some people take 6 hours for that. So that is a relative issue. But what is more important is that you should be disciplined in way you divide your preparation for examination. And if you're working also, then also it should not be like 5 days, oh, I have not got any time, and then I'll start reading on Saturdays and Sundays. It doesn't work like that. So you have to read every day. There's no compromise on that. So for 6 months, you can sacrifice some things, and maybe you can spare some time for reading. So this is what I feel, that you have to have a periodicity and discipline in the way you prepare to examinations. So minimum 2 hours per day. If you're free, then maybe you can stretch to 6 hours. 10 hours, if you are like, at this age, I cannot read for 10 hours. It's just not possible. Just my mind will not able to, I just cannot sit for 10 hours. 6 hours is the peak, my mind gets saturated after 6 hours. Especially for surgeons, I don't think if you're a surgeon, then you cannot sit and read. We are not tuned to that thing. Medicine people can do that, sit and read Harrison for 10 hours. Surgeons cannot sit for 10 hours and read Billy and Love. They have to operate, maybe see patients, some blood and everything, you like that. So that is how it is. Maybe we have perspective Dr. Hamza, because he's a kind of a guy, I admire him for this. Every year he used to get a rank, and then used to ask me that should I go, should I not go. So I admire his this thing, the resilience to get a rank, and then he was so determined that yes, I have to get that seat only. And in spite of the fact getting rank every year, then leaving the rank is not a easy way to do. So, Dr. Hamza, how do you go about your preparation?
So at that time, it was very difficult for me that how to get rank in INI-SS. But once I get associated with the speed and got taught by you, it was very easy for me to get rank in the CML. It was only difficult for me to get rank in AML. So, sir, I think what books you have told and the other people have told to read Sabiston, Shackelford, and selective areas of Bloomgard. But I think, sir, for people who is working as a SR or who is very busy, I think reading your notes in a very disciplined fashion, daily 1 to 2 hours, is more than sufficient if someone understand what you are teaching. So I think reading your notes for GI surgery is more than sufficient to to crack AIMS, because AIMS has a sudden pattern that they ask again and again in a different way. That's why it was easy for me to get qualified and to give interview. So I am very thankful for sir that I don't worry for GI surgery anytime. Even in NEET also I got ranked because they have asked 55 questions from GI surgery. So every problem for me was general surgery and interview. These two things make me more problematic. But now sir also taught some general surgery. That's good for the students, because I used to study more general surgery. I used to study less GI surgery because I was confident. I have a very clear concept. I have made notes and I was very clear about GI surgery. For general surgery, I used to roam here and there, get Sebastian read, and I forgot the stuffs that creates problem. I think reading your notes skin to skin and understanding that what you are teaching, even everything you not give in your notes, what you tell in the first 15 to 20 minutes before starting your class, for example, acute pancreatitis or chronic pancreatitis, that is the gist. If you understand that, after that, reading notes will be very easy. So I think everyone should listen to the class carefully. What he taught in the initial 20 to 30 minutes is all the gist of the four books that sir used to read and come. So and after that, reading notes will be easy. You go daily again and again. You will remember everything. And AIMS people will not. They are very set pattern. Even in the interview, I got rank because of sir only told in the class before 2 days before the class told the guideline of ISGPS. They have asked me in the as a last question of the interview, what we will do, what is the significance of day one of amylase. So I have read religiously the notes of Basant sir, and I am very thankful, sir, because of you I was constant in the list, and I was knowing one day I will be chipping in the list. So I think reading notes of GI surgery from Basant sir is more than sufficient. For general surgery, you have to be bothered. You have to read Sebastian. I think Sebastian is very important for covering the general surgery part.
So it's good you refer to the general surgery part, because there's a big dilemma. How do you prepare to the general surgery part? Because you have 20 questions, I think, from general surgery, and it becomes a big headache, especially if you're reading, say, a GI surgery. How do you accommodate that part in your preparation? Which book should you refer? So I think we'll have perspective from everyone. How do you prepare for general surgery? Maybe we'll start with Uzair. How do you prepare for general surgery part for maybe for your NEET INI-SS?
Surgery, the questions are the topics from which they are asking questions are mostly limited. So we know that there will be some questions from the basic sciences, there will be some questions from endocrine, some questions from breast, few questions from maybe
From trauma also maybe, yeah.
trauma questions will be there, and some like salivary gland questions will be there. So like once I read all this from Savastan, and like once I went through Bailey for the images and the tables which were not given in Savastan, so I think that was enough.
So
Plus some practice of
did you read whole of Sebastian general surgery or portions of that?
the portions only, sir, which were like more important. I have read Savastan for the like NEET SS preparation part also. But for revision for INI-SS, I only went to the important parts, the basic sciences, endocrine, breast surgery, and trauma in some parts, specific parts like this salivary glands, and one or two more topics. Maybe there is some plastic surgery now.
Right, right. So, Dr. Ankit, what do you feel about general surgery part for INI-SS?
Like general surgery is very important because it's a gamble actually. Like out of 80 questions, you get 20 to 25 very easy questions. What I have I saw previous year at toppers videos. Like the gist I got was you should never underestimate the general surgery part, because the 25 questions are very easy questions, and if you give a little bit extra effort, out of 25 you can easily score 23. So there only like your rank will improve drastically. So for reading, what I did was I had brief idea for my MS exam. I have read through Bailey's like general surgery part specifically. And after that, I did read Saviston through skin to skin of general surgery part. I went through all the tables and images of general surgery of Saviston, trauma, endocrine, and breast. And I think that much is more than enough. In any of the grand test or any of the like all the tests I've given, I was easily able to score 20 to 23 out of 25%. So if you have some basic of Bailey's and tables and images of Sabiston, the general surgery is more than enough. And specifically, you have to focus on trauma, breast, and endocrine. That these three are the major chunks of question that you get from general surgery. Else, some GI part also came, but we can tackle that with our SS
Exactly. Yeah.
preparation knowledge. And
Dilip, what do you
specifically
feel?
this time,
Yeah, please go on.
this time, I think general surgery, some of the GI part came, which was very easy for us, I think. And that's why it was high scoring exam this time.
Right. Dilip, what do you feel about the general surgery part? How do you tackle that?
Yes, along with like all of the colleagues said the same thing. Like dealing with our MS during our MS surgery preparation, we have already read Bailey. We have already read some part of Sabiston. So I think majority of the chunk gets covered in those tables from Sabiston as well as from Bailey. Specifically, your trauma, nutrition, your endocrine, breast surgery. So those things get covered. But what I felt was made a difference was solving as many of number of MCQs as I could from various different sources. Because for general surgery, as per se, it is otherwise the portion will be huge. But then to concise and to know the specific points, what INI is usually asks. So from multiple sources, solving different kinds of MCQs, along with obviously reading those tables, really helped.
Yes. Projafri, what do you feel about the general surgery part?
So, sir, this was the first time that I was giving INI, so I don't know how. I could not compare it with the ones, but this time, the general surgery to me was very easy.
Right.
So I put in a lot of effort reading general surgery before the exam, but what the questions that they asked were core general surgery concepts. So if you have done your residency from a good institute where clinical practice is done more, and they ask, because these are the questions which they keep asking in the rounds again and again.
Right, yes.
So it was, for me, it did not make any sense for me putting so much time and effort reading the general surgery before my INI-SS preparation. And only the standard important topics like endocrine surgery or trauma and thyroid, all they were very standard questions, sir. So I believe that if you have done your residency well, and if you have had a good amount of grasp on those core subjects of general surgery during your residency, then this would just be, you just have to flip your pages once before the exam from Bailey or maybe Sabiston. And I think that should be more than enough for general surgery side.
I think that is how it is. What I feel is there are few topics where questions are generally asked from as far your INI-SS is concerned. As you rightly mentioned, trauma is one, endocrine surgery is one. And then, breast and endocrine trauma. This time they're asked from varicose veins also. Yeah, so varicose veins is one thing that you see regularly in your general surgery posting. So questions are not that difficult, but yes, you cannot be complacent about that because it can easily, pull you down in your ranks, final ranks. So it has to be taken seriously. At the same time, you cannot be just reading only general surgery and then skip the rest part of it. So it has to be a good balance between that. And then the best way is to just address the topics that have been asked in the last 5 years. Maybe you can just go through the recalls of 5 years, the general surgery part I'm talking about. And if you just address the topics that have been asked in the 5 years, more often than not, you'll get around 80% of the topics. You'll find that they are just repeats. The questions might be different, but the topics are just getting repeated every year. Right. So it's just basic general surgery stuff that you have done in residency, breast, thyroid, varicose veins, general aspects of nutrition and all those things. I don't think it's that difficult, but yes, it has to be taken seriously because every question has the same weightage. So a simple general surgery question has the same weightage as a very tough GI surgery question. So if you get the tough GI surgery question right and you get the simple question wrong, then you are at the same thing, same level. So every question has equal importance. There's a point I want to emphasize that you have to take every question seriously because that can pull you or bring you down, or you can just get it into the top 5. So this is a very good, important thing in your preparation, that you have to take everything seriously. You cannot be complacent about anything. At the same time, you have to balance your time also, right? Now coming to the last part of the preparation is your MCQs, right? So what is your opinion about your solving previous year papers and all, do you find that things are getting repeated, or what is your opinion about that? So before the examination, do you solve last 5 years papers or something like that, Nilay?
Yes, sir. Definitely solving MCQs is a big part of our preparation, along with the once you have read that topic, just to analyze the each MCQ and to extract your knowledge which you have read and to extract it and to apply it. Like in many of your videos, almost all of your videos, you have a segment where you cover just the MCQs and to how to approach those MCQs. I think that approach for us to develop, I think solving maximum number and previous year questions, yes, definitely. I think last 5 year questions from whatever source you can find. I think a lot of YouTube videos are also there who discuss the previous year questions after the exam. And I think watching those videos definitely will help, because I think out of the 80 questions, 10 questions are such that at least the 10 to 20 questions the concept is to definitely repeated, and sometimes directly the question may also be repeated.
Right. Dr. Chakravarti, what do you feel about solving MCQs? What is your opinion about that?
Sir, MCQ solving is the most important thing I feel, sir. More than any reading, revision, everything. MCQ solving is most important. I solved I have set a limit, like daily 100 MCQs I have to solve like that. For last 3 months, I have solved 100 MCQs per day. And repeat MCQs, as previously from previous years, especially in INI-SS, there will be definitely repeats, at least the topics. And from AIMS SR exam also, those questions also will get repeated, sir. So it is better to see at least 3-4 years AIMS SR exam papers also, sir.
Yes, right. So, yes, as you rightly pointed out, MCQs are very, very important. So, it will help you to apply the knowledge that you have read. So, unless until you know how to apply what you have read, it doesn't make any sense reading just blindly books. So, that is very, very important. As you rightly pointed out, you have to make a point that once you have read a topic, once you have read it from different sources, you start solving questions from that. Because unless until you solve questions, you will not be able to apply the knowledge. So that is very, very important. I feel that you make a point that after reading a theory part, you solve at least 50 questions per day from whatever source you can get from. That is very, very important, because it will help you to because it's just like a mock examination. So examination you have to do solve MCQs only. So this is very, very important, that some people just read theory and don't solve MCQs. That is a big mistake that you're doing. So you have to solve MCQs. So once you read the theory part, go to the MCQ portion of whatever you are following, solve them. That is very, very important. At the same time, I would like to point that you should not memorize MCQs. That is a wrong thing that people do. They start memorizing option. Oh, this is a question that has been asked last year. This year also they will ask the same question. So they start memorizing the option. Don't memorize the option. You have to go back. Suppose you think that this is a very important topic from the MCQ. MCQ has been asked from that. Go back and read again. So even if you're solving MCQs, so in our days, we used to call it as a retrospective study. Some people used to study prospectively, so reading the books and then solving the MCQs. I knew very, bright students who used to study retrospectively. So they started with the MCQs only, and then they will read the MCQs, then see the topic, go back to the book, and then read the topic from that. So it's a different way of studying, but I think what is more important, that yes, you solve all the MCQs, but remember the concept. What is the basic idea behind that question? Because the examination, they are very shrewd. So you'll feel that this is a repeat question, but it's actually not. So some things have been changed, and maybe the scenarios have been changed, the options have been tinkered a bit. And if you are just thinking of memorizing the option, then you'll fall in their trap, because they know that you have access to all the previous year papers. So they're not fools. So they know everything. So you have access to the papers, you have access to the questions. So everything, they know that. So they will make a point that they will simulate that question, and you feel that, oh, this is just a repeat question asked last year, and then the options will be same, but slightly they will tinker it, some information, and then you'll fall in that trap. So what is more important, that yes, you solve the MCQs, but more important than that is you use the MCQs to remember the concept and the facts, and then use that same concept in the examination. Okay, don't memorize things. That's the point I want to make. So surgery is not about memorizing things, it's about applying things. As surgeons, you are expected to apply your knowledge. right? So it's not about gold standard and all those things. So just see why is that gold standard. Even if you are suppose this is an investigation, a gold standard for this, pathology, then you have to ask yourself why is that gold? Why is that other thing is not a gold standard? Why is that the gold standard? The moment you ask a why before you read, then things will be much clearer to you. And this was taught to my one of my professors that whenever you're reading, ask yourself why. Say you're reading a chapter also, no? Just before the paragraph, ask yourself why. Moment the why comes in, the your all these things, memorizing things goes out. Then you are basically a science student, right? Surgery is a science. So you have to learn surgery as a science student. Ask yourself, question yourself. Question the authors also. Why is that he is telling that? So you have to develop that habit right from your starting of your career. You cannot just take things at point blank that yes, somebody is saying that it should be right. It cannot happen like that. You have to question yourself. You have to question the person who's saying that. And the moment you start doing that, you will start to assimilate things in a much better way. And then at any point of time, if you're asked to reproduce that, then you will be able to, do that in a much simpler way without getting the force of that you have to memorize things. Okay, so that is very, very important. That's the philosophical part of reading surgery, right? So last few minutes, any advice? So what is your last minute advice? Everyone can just chip in for maybe 2-3 minutes. To start with Ozair is right in front of me. So okay, Ozair, what is your last minute advice
Yeah,
preparing for
images.
NEET SS and
Don't
NEET SS?
like images, all images of Shackleford, like someone has to see before going for exam, at least the important topics. So like all the
Right.
echocardiograms, all whatever CCT or MR images are there, at least the gist of it, not like exactly the image that you have to remember, but at least what image is trying to say or what is being depicted as that image. That
Good.
is
I
true
use
for
all
Shackleford
information.
and Sapiston and Bailey also. Some images there we have to know like why that image has been given.
Okay. Ayush, what is your last minute advice?
So my only advice is don't count yourself out. It is very much possible even in the first attempt. And the only key I feel is MCQ solving. The GTs are hardly 80 questions. They hardly take 30 to 40 minutes of your day. And there's no right time to solve. You just have to do it start from day one. Because the more questions you solve, the more familiar you are with the questions and topics. And as they keep getting repeated, there is no going back from questions. So I think questions and not counting yourself out.
Okay. Dr. Ankit.
Sir, a few advice is like never miss the previous year questions
Right.
and never miss general surgery part because it's
Mhm.
just your extra 5 or 5 days effort you will get into 25 out of 25 questions. And
Mhm.
third advice is plan your pre-exam day and exam day. Those two
Right.
are very most important thing because I know some of my friends who were more prepared, but their exam day didn't go well. So sometimes they
Mhm.
panic. Please don't panic in the exam. That also counts that we often miss because exam day out of panicking we tend to do few questions wrong. That is our
Mhm.
like right. I feel so. If apart from preparation, if we keep these few things in mind, I think we will get through.
My last minute advice will be at the end, the 72 hours before your exam, you need to have, like Ankit rightly said, a 20th notebook, which we had a concept in NEET PG. So
Mhm.
something similar to that, last minute revision textbook, or some textbook in the sense, some notes should be there, which you can cover in 72 hours, and which should include your mistakes in which you have solved. Maybe you have solved grand tests and you have found out this is a common mistake I'm doing in every exam or every time, or an MCQ section, say biliary injuries or whatever, which you are finding very difficult. Just some 50 to 80 pages of your text notebook, and that should be just be covered in 72 hours. I think that revision matters the most because you have been studying since the past 2 months, and this is the final phase is what you need to know your mistakes. That's it.
Good. Great. Okay, Dr. Jaffrey, what is your last minute advice to the students who are preparing?
So, sir, for me, the key to INI-SS MCH Surgical Gastro is Dr. Basant Singh's video lecture.
Not like that.
No,
You are
no,
giving wrong
no.
advice.
I have to tell you very honestly, sir, and I'm not saying it out of just, I mean, all of your students here would agree to this. For me, the key is Dr. Basant Singh's lectures. And once you know the subject well from whatever sir has taught, it becomes really very easy. So that is number one. Number two for me is making notes. So if you have prepared notes, it will really help you during the last leg of your preparation. A month before the exam, you would want to go back to your notes. Number three would be solving MCQs almost every day. So it should not be that you are solving this. If you have read the particular topic today, don't solve the same topics MCQ tonight. So it doesn't make sense doing that.
Right.
So have a lag of at least 2-3 days, so that you are revising in a way. If you're going ahead with your preparation, MCQ should be 3 days, a topic you have done 3 days before. So that will give you an edge. So you would keep remembering it. I think that would be the way. So, but truly, Dr. Basant Singh's video lectures would sail you through this exam easily.
It's the thing like that. What I feel currently is that at your position, you should get information from every source that is possible. So all the platforms that are there, all are good, right? So important thing is that if I was at your position, I would take information or knowledge from anywhere or whatever, by hook or by crook. Okay, I'm not in a position to negotiate that this is good, this is bad. Everyone who knows better than you is a teacher, right? So get information from everywhere by hook, by crook. The only thing that matters is your ultimate rank, right? So this is very important that yes, every platform is good, everything is good. You just read, invest yourself for 6 months, burn yourself for 6 months, because that is what will matter. Because all the years, I'll come to you, all the years that we have spent, 6 years of MBBS, then 3 years of residency, then maybe senior residency, is just for this examination. Because this thing you'll carry for your whole life. The degree that you get, you'll carry this for your whole life. The profession that you choose once you enter the MBBS, and if you are planning to become a GI surgeon or a cardiothoracic surgeon, you are going to practice the same damn thing for your whole life. So this is the most important point in your career. This will make or break it. Yes, Dr. Jafri, you were saying something. Yes, Dr. Hamza, you are the veteran one here. So we like to hear from you. Last minute advice.
Yes, sir. First of all, जो डेस्टिनी है ना, दैट इज, एक तो ऊपर वाले हैं, दूसरे की अपने को सोच के चलना है कि मुझे आगे लाइफ में क्या करना है. तो पहले तो बहुत टेंशन नहीं लेना है, बिकॉज इट इज अ वेरी डिफिकल्ट एग्जाम. ऑल द टॉप नॉच वांट टू गेट जीआई सर्जरी, उसमें भी एम्स से आईएनआई. तो बहुत घबराना नहीं है, क्योंकि मैं भी सर को जब भी फोन करता था एग्जाम से पहले, सर बोलते थे अब 2 दिन आराम कर, जो होगा सो होगा. तो इस वजह से सब पढ़ते हैं लास्ट में, और लास्ट में रिलैक्स होकर एग्जाम देना है. दैट इज वेरी इंपॉर्टेंट. कितने बार मेरे भी कितने बैचमेट्स या कलीग्स, उनकी 12 आई, वो लोग डिजर्व करते थे. कितने लोग की 15 आई, वो 1 लाना डिजर्व करते थे, बिकॉज आई यूज्ड टू डिस्कस विद देम. तो लास्ट में पैनिक नहीं होना है, अच्छे से एग्जाम देना है. और INI-SS के लिए आई थिंक बसंत सर के नोट्स को अच्छे से पढ़ के समझ के देना एग्जाम. यू विल बी इन द टॉप 5. और ये डेफिनेटली, बिकॉज आई हैव बीन डूइंग, मतलब मुझे हो गया था कि आई विल बी देयर. दैट्स व्हाई आई वाज इन्वॉल्व इन दिस. तो बसंत सर के नोट्स पढ़ने हैं, और जनरल सर्जरी को अपना 2-3 जगह से जमा करके, मेनली सेबेस्टनी पूछते हैं वो लोग, वो 1-2 टॉपिक ही रिपीट होता है, उसमें एक टेबल आगे पीछे करते, कभी सोडियम पूछते, कभी पोटेशियम पूछते. तो वही करना है और रिलैक्स होकर एग्जाम देना है. जूनियर्स को ज्यादा स्ट्रेस नहीं लेना है, क्योंकि लाइफ में डेस्टिनी जिसकी है जहाँ पहुंचा देगी. क्योंकि ये बहुत ही डिफिकल्ट एग्जाम है, बिकॉज थ्योरी में भी आप CML1 भी लाए तो कभी कभी AML वो 10 हो जाती. तो उसके लिए टेंशन नहीं लेना है. उसके लिए टेंशन नहीं लेना. दिस इज अ पार्ट ऑफ लाइफ. और सर का इंटरव्यू सेशन भी बहुत ही स्टैंडर्ड है. उसको समझ के एब्जॉर्ब करके एक दूसरे से डिस्कस करना है, जो आपके कलीग्स हैं. तो आई थिंक अल्टीमेटली दे विल टेक यू.
So basically, one right thing that you pointed, that is very important to be relaxed before examination, because I've seen many people who are taking alprazolam before the night of examination just to have a good sleep. So that happens, that's just human behavior to be jittery and sleepless before examination. You cannot prevent that. Even I'm a jittery person, I must admit that I guess get very jittery before my examination. So that is a part of your human nature. But yes, you have to try to calm yourself in whatever way you can. And that is a very important thing that you pointed out, that you have to be relaxed before examination. So I just share a small story about me only. So the center was in Delhi, so I was in Chandigarh. So I traveled after the routine work, I traveled for the examination. my younger brother is basically an MBA guy, so works in Gurgaon now. So he received me in the at the railway station, like, have you read for the examination? I said no. Then let's go party. So tomorrow was my examination. Like, it took me from, okay, we have a corporate party, so we'll just party, and then tomorrow we can go. So okay, I have not read also. Then I'll just have some good time there. So we just walked around, and maybe, the point was that I had relaxed time. Just day before examination, I was not reading, flipping through books and everything. Maybe after 7 o'clock, you should stop reading. So that is what my seniors would advise me, that before examination, 7 o'clock should be your last time that you open a book. Stop everything after that. Nothing will change. Your rank will not change. Reading late in the night and just flipping through your previous papers. 7 o'clock is the time. Set a time. At 7 o'clock, yes, that's it. I'm done. I'll go have a coffee. Maybe I'll chat with my father, mother, whom you're comfortable with, and then you go to sleep early. Maybe at 10 o'clock, 11 o'clock. Don't go late in the night. And then what happens is that anxiety compounds, is a positive feedback cycle. And then early morning, you are not slept well, your mind is all jaded, and you don't know what to do. That happens. And that will easily, pull you back 3, 4 ranks. Not more than that, maybe not more than that, but yes, definitely, if you get 3, 4 silly, you make 3, 4 silly mistakes and you're gone. So that should not happen. That you should be very relaxed, and the only way is that you stop studying. That's the only way that you can relax. You just stop studying after 6 o'clock, 7 o'clock. Go for a walk, go for a run. If you want to hit a gym, then go there. That's the best way to relax, I think. At this point of time, work out for 1 hour. Go to a gym. Go just run for 5, 6 kilometers. Then your mind is fresh. Everything is fine. You get a good sleep also. So that's very important. Small tips, but that can alter your final preparation. Dr. Jaffrey, you were saying something.
So, sir, I was just mentioning that INI-SS, as I understood preparing for it, is it is an easier exam to crack than NEET SS.
All of us agree that INI-SS is an easy examination to crack, provided you have a systemic approach to the
exactly.
Yeah.
And that I think you are the master of that, sir. Because
I'm not the master of that, but yes, this is my passion to teach you people, because I like teaching. Yeah,
Yes.
I've been like that since my UG days. I used to teach my batchmates also. So I have this habit of teaching, because I remember things. If I teach, then I remember things better, and I get this kick, you can call it. So it's in my gene, teaching.
Sir. So what I believe, sir, if you have a correct roadmap
Yes.
to INI-SS, it becomes really easy to crack this exam. A particular source which they need to be consistent with, and I think then it becomes really easy to sail through this exam. Number two, sir, it's been only 1 month that I have joined AIIMS New Delhi, but your lecture videos and the concepts that I made listening to your videos back in the time when I was preparing is helping me even right now, because those are the same things that are repeated and asked to me on rounds even today.
Surgery never changes.
It never changes.
It never change. It will never change. It will just, progress. It will never change. The basics never change. People. Yeah.
So that is how it is, I think, so. It's very easy, and I think you can. Everyone here would vouch for it, and all your other students would also vouch for the same, sir.
So I think it's about the passion. In the end, it's like how passionate you are for your subject. It can be any specialty. It can be GI surgery, urology, but in the end, what I feel, that if you have a passion to achieve something, if you really want to do that, if you want to follow that line, follow that specialty, you will achieve that goal.